Hello, Dr. Hop. This is Rita. My live audience is my son Diego. Say hello, Diego. And today I'm going to be presenting my persuasive speech. And these ones are my flashcards. An organization that defines how broadly a complete state of physical, mental, and social well-being, and merely the absence of disease or infirmity. The World Health Organization promotes health by keeping the world safe and serve vulnerable population. First, I am going to be talking about the problem the U.S. is facing by cutting its membership with the World Health Organization. Second, I am going to be talking about the cause of this problem and how we got to this point. And third, I'm going to be sharing a possible solution to the problem that we are facing due to these cuts and collaborations with the world entities in our limited response to a potential health threats in the global stage. Today I will be talking to you about why the United States should remain part of the World Health Organization. I'm going to talk about the problem. The problem the U.S. is facing by withdrawing from the World Health Organization. First, according to the Centers for Disease Control, on January 23rd, 2026, for the Global Health Center, official documentation by the U.S. Department and Human Services, HHS, and the Centers for Disease Control and Prevention, CDC, the withdrawal was ordered as necessary measure to protect America's interests due to core failures within the UN agency. Second, after President Donald Trump signed an executive order on January 22nd, 2026, obtained by Erica Edwards and Jennifer Jed on January 23rd, 2026, NBC Health News. This exit has cut 15% to 20% of the agency budget and severs several critical ties to public medical. Experts noted that the U.S. faces significant domestic health and security as direct result. Last, the U.S. loses direct access to the global network that tracks international health, according to King Nor Shine on January 22nd, 2026, for the University of Michigan School of Public Health. Dropping out prevents the U.S. from shaping international health rules of security protocols. The cost. First, a primary problem was the U.S. administration stated that the World Health Organization was overly influenced by China, reported by Fox and Orderlight Michelle on January 23rd, 2026. NBC News especially alleging that the agency helped cover up the initial origins of COVID-19. Second, the administration stated, according to the U.S. of Health and Human Services, January 22nd, 2026, that the World Health Organization continuously refused to implement necessary reforms regarding this operation, accountability, and transparency. And third, this trend will have an adverse consequence, according to Bahir Jassi Faiz Sadavi, March 18, 2025. NIH for future pandemic preparedness, health inequities, and across-the-border collaborations. The solution. First, according to legal analysts published by Alice Parks, January 22nd, 2026, Time Magazine, the Congressional voted resolution that admitted the U.S. into the World Health Organization in 1948 dictates that the country cannot legally completely withdraw until it has fully met its financial obligations. Second, streaming data collection and improving independent verification process, enforcing strict compliance mechanisms for member states, and reducing political influence between decision-making structures. Last, collaborative leadership noted that driving these reforms from between by reestablishing a collaborative funding framework, it's the most effective way for U.S. to preserve its global health influence and protect national security. To summarize, first, we talk about the problem the U.S. is facing by withdrawing from the World Health Organization. Second, we talk about the causes that lead to withdrawal from the World Health Organization. And then third, we analyze the different options available to be able to reinstate funding and regain trust around the world. In conclusion, even though it was unlawful to withdraw from the World Health Organization while owing money to this entity, an executive order was signed on January 20, 2026, and the U.S. officially withdrew from the World Health Organization, also known as WHO, on January 22nd, 2026. Health experts warned that exiting this entity will only make America biosecurity more vulnerable, and entities like CDC and CDC Prevention are now cut off directly from real-time international health data communications that will provide with early warning systems for future outbreaks. Thank you.